Well, sometimes it's easy to forget that the COVID-19 pandemic has been with us for less than 6 months. Intense research has been underway and we're still learning new things every day. It seems that a significant number of people infected will continue to experience symptoms for a lot longer than others. This is particularly significant for employers to take note of. The Futurist Graeme Codrington joins us now for more on where the research is taking us. Graeme, good evening to you. What this really tells us, we actually don't know enough about how this affects human beings, and it seems to affect some people in different ways, more severely, and for a lot longer than others.
Absolutely, Stephen, and you're precisely correct. You know, this novel virus is novel because we haven't seen it before. And researchers have obviously been working around the clock for the last 6 months to try and understand it more. We've probably understood this virus better than any other virus in foster, but we're still learning more about it. And interestingly, recent research has indicated that maybe we shouldn't only be looking at the number of deaths. Fantastically, this disease isn't as fatal as many other diseases are, and there's only a small fraction of people who succumb to it. But we mustn't forget, and I think maybe in South Africa we are forgetting, that a significant number of people, probably close to 20% of people, get severely ill. So they might not die, they might not even need to go to hospital, but they are taken out of their work environment, they're taken out of their normal life for anything up to 10 weeks at a time. This is now the anecdotal evidence that is being backed up by medical research. Worse than that is that doctors are beginning to say that they are concerned that they see the potential for long-term health problems with anybody who gets COVID. Even if they only show mild symptoms while they have the disease, it could have huge impact on all parts of their system, particularly lungs. Dialysis is something that a few people have had to do, and brain function. What this means for us, I think, especially as we anticipate maybe a shift in the next few hours of a level 3 lockdown requirements of us, is that even if we have the potential to go out to restaurants, to get our hair cut, to travel, we absolutely need to still be careful of getting this disease. It isn't just about whether we die or not. It is about the impact that it has on us if we get it, and maybe long-term impacts as well. All of that comes down to what the doctors are calling viral load, which is how much exposure you have to the disease. We need to just continue to limit the potential exposure that we have to people who might be infectious, even if they don't have symptoms.
I mean, the thing about viral load is very interesting. I mean, some of the people who've had very severe cases of COVID-19, health workers, I mean, presumably they're the people who are most in danger of having an increased viral load. They simply came into more contact with the virus, or more of the virus, if that's the right phrase, than other people.
Yeah, and Stephen, I think this is one of the interesting things that medical professionals are seeing. You know, with some diseases, you get a small exposure and then the disease builds up in your system. It does appear that COVID-19, the more you are exposed to it, the more severe symptoms you get, which of course means that healthcare workers and some of the community workers in South Africa that have been doing the screening are at a lot more risk than others. But it would be a similar situation if you were sitting in a restaurant near or next to somebody for an hour or two who might have COVID, or of course, depending on how long it takes to cut your hair, you know, if you need a few hours in a hairdresser's seat, that could dramatically increase the viral load that you get.
And then this sort of second wave, I mean, New Zealand's had a couple of cases after they believed that, I mean, they were playing sport in live stadiums over the weekend. Beijing is closing all of their schools. I mean, this seems to be a bit of a problem.
And this is exactly, again, if we look at what the medical experts have been saying, there are no surprises. Not a single medical expert is surprised that there are second waves. Again, one of the very interesting things about COVID-19 is this period of time, 5 to 10 days, that somebody can have the disease absolutely no symptoms, not knowing at all that they have the disease, but they can be spreading it. And that really has been why COVID-19 has been so different from anything else, whether it's TB or HIV or any of the other flu-like diseases. It's because of this period where you can infect other people without knowing it at all. And that's, I suppose, the medical professionals in other parts of the world, Beijing, Brazil today, would probably say to us in South Africa, don't go too crazy. If you're allowed to get out into public, continue to maintain that physical distancing, wear your masks, and be alert. It's not just the death rate we need to be looking at. It's also the long-term impact that this disease might have on all of our health.
Graeme Codrington, thanks very much indeed. Really do appreciate it. The Futurist with you here on The Pulse.